Chances are, if you wear glasses or know someone who does, you've heard the term nearsightedness. Being nearsighted means a person can see well up close to a certain extent or distance depending on the amount present, but objects in the distance are further than they appear. Oh, just kidding, that's car mirrors. Objects in the distance are blurry. The technical term for this is myopia, and today we'll talk more about what it is and why it matters, especially for kids. A myopic eye is essentially overplus, which is why minus power lenses help correct the vision. This can be due to several things. Most of the time, it means the eye is longer than it should be from front to back. It can also be caused by the cornea, the front clear part of the eye, being too steep. Either of these causes create the focal point to land inside the eye instead of on the retina, which is the tissue at the back of the eye. Glasses or contact lenses correct this by pushing that focal point onto the retina, but they're only treating the symptoms of the myopia, the blurry distance vision, and not the cause, the eye being too steep. Most of the time in adults, this is not a concern because that person and their eyes have stopped growing. But kids are still growing their height and their eyes. So for a kid with myopia, the eye that's already longer than it should be continues to stretch and grow longer. This is concerning because as an adult, a longer eye puts that person at a higher risk for several eye diseases. There are basically two causes or risk factors for myopia progression. First is genetics, so having one or both parents with myopia increases the child's risk, and second is their individual risk. Low outdoor time and high screen time increases this individual risk. The demand on our eyes with increased near work, especially with computers, phones, and tablets, limits our focus to arm's length or closer, which causes eye strain and contributes to myopia progression. A child doesn't always know what they should or shouldn't be able to see, so they may not have any vision complaints even if they have myopia. As a parent, we should watch for things like that child squinting more often when focusing in the distance or watching TV, complaining of not being able to see the board at school, especially if their teacher moves them to the front of the classroom, or holding reading material or digital devices closer to their face. If you notice any symptoms or problems, schedule a comprehensive eye examination for your child. School screenings or a quick vision check at the pediatrician's office don't take the place of a full eye examination by an eye care provider, either an optometrist or an ophthalmologist. We not only check vision to see if the child needs glasses, but also assess how the eyes work together and look at the overall health of the eyes. Updating their regular glasses doesn't always help slow myopia progression because glasses only help with correcting the blurry distance vision, which is again the symptom of myopia, but they don't treat the underlying cause to help slow progression year after year. There are 3 available treatment options in the United States to slow myopia progression. Some kids might be a better candidate for one treatment compared to another, so it's nice to have the options. 2 of the 3 are different types of contact lenses, which both focus light rays into the eye in a way that sends a signal to slow the rate of growth. One is ortho-keratology, which we call ortho-K. These are custom designed contact lenses worn overnight, which gently reshape the front of the eye, similar to how braces work for teeth. With ortho-K, the child doesn't need to wear their glasses or contacts during the day to see. The second contact lens option are dual focus soft contact lenses worn during the day. They send the same signal to slow progression and also help the child see while wearing the contact lenses. The third option is a low concentration of atropine eye drops. One drop is placed into each eye at bedtime, and these are thought to slow the rate of growth by strengthening the outer layer of the eye, the sclera, to help prevent stretching. With this option, the child does still wear their glasses during the day. Ortho-keratology contact lenses are specifically designed to be worn overnight, so they have a high level of oxygen transmission. The main risk of wearing contact lenses overnight is microbial keratitis, basically an infection. But the risk of infection with wearing ortho-K contact lenses is similar to the risk of wearing any type of daytime contact lenses, and research and studies have shown that to be an overall low risk. However, it is still important to follow good hygiene, washing hands before inserting or removing contact lenses, cleaning and disinfecting the contact lenses properly, and reporting any symptoms of pain, watering, redness, or blurry vision to your eye doctor as soon as it happens so that a potential infection can be treated quickly. Things that can help slow myopia progression, especially in slowing the onset, so before myopia even develops in young children, are 1. Increasing their outdoor time, 2. Reducing screen time, and I know that's hard in today's environment when everything is on screens. 3. Taking breaks from digital devices, even if it's just a quick break to stand up, stretch, look out the window briefly. And 4. Having good lighting and good posture when reading or using digital devices. Okay, you've made it this far in the video and you've listened to all I said. You may be asking yourself, now what? I know all the options can be overwhelming, especially if you're hearing about them for the first time or when you take your child to the eye doctor only expecting them to need new glasses to get an update. Taking a little time to get more information and research it on your own is a great idea, and there are multiple resources available for parents. I'll link some below. But you can also reach out to your local eye care provider for more information. Just don't wait the entire year for their next annual exam to roll around, because during that year, your child's eyes are growing longer. With all the research and treatment options currently available to help slow the progression of myopia, it really should be standard of care for all myopic children. So find an eye doctor that practices myopia management and schedule a consultation to find out what the best option is for your child.
Like and subscribe to our mom's channel to learn more about eyes. Bye!